For the finding of remote neural damage after denervation, is there any identified mechanism or hypothesis to explain such findings?
There is a possible explanation for this kind of finding. Basically, the finding is that renal denervation will cause damage as far as the brainstem and the stellate ganglion. There is a neurological phenomenon called transneuronal degeneration, where the cell deaths from one neuron will cause subsequent deaths in connected neurons. And that is probably the best mechanism to explain these findings of remote neuronal damage by renal denervation. I think the same principle may apply to other neuromodulation procedures.
It seems denervation carry both benefit and damage. Based on the current scientific evidence, will you recommend this kind of procedures to your patient?
Yes, just like all medical procedures, there are benefits and risks. So when we give a patient a drug or recommend a surgical procedure, it also depends on the benefit to risk ratio. So when it comes to neuromodulation, we should not use this for patients who have no symptoms, obviously. But for patients with severe symptoms or patients' life is at risk, I think neuromodulation procedures carries better benefit than risk, and those might be recommended. For example, in patients with long QT syndrome who is refractory to beta blocker therapy, stellate ganglion ablation is considered a class 1 indication to save the patient's life. So these are examples. The damage of the stellate ganglion is the risk, which can cause a lot of potential side effects, but the benefit is to save patient's life. Therefore, a benefit-risk ratio calculation is very important. But just like any anti-arrhythmic therapy, neuromodulation procedure could also be pro-arrhythmic. So our recommendation has to be based on scientific evidence and based on patient symptoms and prognosis.